The population in Europe is aging. With longer lives comes new challenges. Our heart, our bones, our brains also grow older. What if computer models, also called digital twins, could help us understand how these organs deteriorate as we grow older?
Our team is going to explain what a digital twin for health is.
We do it for different target groups. In this episode, we have Ray and Uzair.
They address clinicians,
like doctors or nurses.
Okay, so maybe to start, what do clinicians actually need to know about digital twins?
A digital twin is a visual representation of a patient's organ, and it's usually made by a combination of a large sum of data gathered from, let's say, the clinical health records, MRI scans, or even clinical test results. This provides the doctor or clinician with personalized information about the patient. This is something that is quite new and we didn't really have yet. Overall, this is groundbreaking. The doctors now have information to be able to predict, help for decision making, or even have support with patient engagements. So this could be used in simulations and modeling. How is this relevant for clinicians?
Well, I think what's important about digital twins is that they allow clinicians to evaluate different treatment options without any risk. So you can decide based on a specific patient's physiology or their medical situation, you can decide which treatment is best for them. So for example, if a patient is suffering from, let's say, cardiac arrhythmia, if we have a model of the electrophysiology of that patient, we can examine how different types of pacemakers or different placements of pacemakers would affect that individual's situation. Or in the case of maybe coronary artery disease, we can simulate the blood flow in the vessel to see how different designs of different stents or different placements of stents would affect things before we then progress with invasive surgery. But I'm curious, beyond just optimizing treatment designs and deciding between different treatments, what else can digital twins do?
Glad you asked. Briefly mentioned earlier was predictive modeling. Digital twins can allow doctors to have a prediction on what might happen in the future. So let's take a heart attack, for example. If a patient suffers from a heart attack, a specific model, patient-specific, of a heart that the doctor has might allow for them to be able to predict what might happen, let's say, in a few weeks or even months ahead. For stuff as serious as heart attacks, this is great because the doctor will be able to implement measures before anything gets more serious, like before another heart attack occurs. We can also take the brain, for example. If a doctor has a model of a patient's brain specific, they will be able to notice or have stuff implemented for Alzheimer's or dementia before they get serious, of course. For these conditions, there's no cure. So especially in cases where there is no cure, it will be important or valuable for the doctor to be able to implement measurements for symptom management or, if possible, preventive measures. Another way of this is, let's say, drug development. This isn't directly relevant to the hospitals, but new drugs and new targets is valuable for better treatments. Digital twins are able to identify or help identify new biomarkers and new targets. Again, this is valuable for anything that has no cure. So what does this mean for the future, let's say, in precision medicine?
I think we need to remember that digital twins aren't there to replace the clinician. We want them to be another tool that clinicians can draw on when they're making decisions so that they can make decisions informed by a specific patient's physiology and their medical situation. And in this way, we aim to facilitate this movement towards precision medicine, towards more personalized care. Ultimately, the goal of this research is to improve clinical outcomes. And in order to do that, we need to make sure that these models are trustworthy and reliable, and that they provide clinicians with insights that they can trust and that they can actually use in the clinic with patients.
Our InSilicoHealth candidates will move beyond a technology-driven focus. They will also be exposed to ethical, legal and societal aspects of virtual human twin technology. This will prepare them to proactively address the complexity of healthy aging from a 360-degree perspective. They will be trained to become key figures in shaping the in silico healthcare of the future, where computer models help support healthy aging.